I'm Sarah, Quality Improvement Program Analyst and member of the Alliance's Practice Transformation Academy team. Welcome to the second episode in our ABCs of Quality Improvement series, Project Charters. In this video, we will discuss the importance of creating an effective project charter and review each of the questions you'll need to answer when writing one so that you can craft your next project charter with greater ease and put it into work as the foundation of your improvement project. If you haven't had a chance to view the first video in our series, which covered SMART aim statements, one of the components of a project charter, please be sure to check it out. If your clinic is tasked with a quality improvement project, or if you have an interest in improving in a particular area, then crafting a project charter will be the first step in getting your venture off the ground. Put simply, a project charter answers the following questions about a quality improvement project. First, why are we doing this project? What are we trying to improve? Who is going to do it? And lastly, how will we know that we've been successful? So let's approach project charter development as a tool that will help define the issue to be addressed and refine and provide direction for the improvement. Once complete, the project charter will allow you to easily communicate a common vision and purpose for the quality improvement project with stakeholders. And by taking the time to create a well-thought-out project charter, you will set up your team for success by establishing a high-level overview and scope of the work you plan to do and define the roles and functions of each team member. Now let's walk through a sample project charter. The first item to address is the problem statement. Here we need to define the issue that's driving the quality improvement project that you're working on. Your definition of the problem should include specific details about how, when, why the problem is occurring, what's it affecting, and what is the impact. For example, Alliance Clinic's childhood immunization status, or CIS, of combination 10 vaccines is at 12%. This is well below the NCQA minimum performance level of 35%. The low rate is attributed to poor compliance around the flu vaccine. Upon further review, we found that although 36% of your children received the initial flu vaccine, they weren't coming back for the second dose. This was overall affecting their rates. Now we need to lay out the expected outcomes, or SMART aims. In this section, we must provide specific and measurable objectives and numerical targets. So something like increase flu vaccination rates from 9% to 35% for children 0 to 2 years old in Merced County by Q3 2021. An important driving force in any quality improvement project is really the why behind it. So, why is it important? And how will the improvement benefit your clinic team and your patients? This section may also include what led you to select this particular project and how it will support greater goals for your clinic. In this sample project, we identified performance gaps, or being below NCQA goals, and organizational priorities, like improving childhood health and wellness, as factors that led us to turn our focus on improving flu vaccination rates in order to have a more positive impact on overall childhood immunization rates. The next step is to define the project scope, the boundaries of the project, so what to include and exclude. This will provide more clarity around the start and end points of the process, define potential constraints, and also establish the amount and intensity of resources needed to complete the project. Sometimes you may need to limit the scope to provide proof of concept. In this case, we could limit the scope of the intervention to just one pediatrician or even just one of your clinic sites. Once positive results have been observed, the intervention could be expanded to include additional clinicians or spread to other clinic sites. Remember that as with your aim statement, the scope of the project may change as your project progresses and you learn more. Consistent communication with your project team will help to maintain clarity within the project and avoid scope creep along the way. The next section is where we will identify the project team and assign roles. The Agency for Healthcare Research and Quality states the optimal size of a QI team is between 5 and 8 individuals, although of course this may vary by practice site. They also mention that the most important requirement is team diversity. So it's not just the size that matters, but including those who have different roles and perspectives on the patient care processes being analyzed. Let's review the 6 main roles to be filled. The first position to be filled is the project sponsor. This person is a senior leader with formal authority and ownership of the process being improved. They're not typically day-to-day participants in your project, but will review the team's progress on a regular basis. The sponsor provides strategic direction to the team and selects the focus and goals for improvement. They also review the team's work plan and may act as a liaison with other areas of the organization. By providing resources and helping the team to overcome barriers, the sponsor has a key role in ensuring the success of the improvement project. The project team will also need a provider champion. This is someone who can help generate provider buy-in and bring the perspectives of the physicians to the discussion. Next is the project lead, the driver of the project. This must be someone who understands not only the details of the current system, but also the potential effects of making changes to the system. Their holistic knowledge allows them to work closely with the sponsor, the practice coach, and the team on the development of the project work plan and its implementation. The project lead coordinates the team's work, provides updates on progress, and assists when challenges arise. It's imperative that this person is able to work effectively with everyone on the team to ensure that the different aspects of the project are working in unison. The people who are making the changes at the ground level are the team members. They attend and share updates at weekly meetings, contribute to the development of the work plan, and actively participate in finding solutions when challenges arise. As team members work to implement recommended changes, they will also gather information relevant to the project, help collect data, collect action plans, and provide feedback to the team on changes that are being made. As needed, the project team may also include subject matter experts or SMEs. They are technical or clinical experts in a specific area of knowledge that will provide additional information and support to the team. One SME who is critical to include is the electronic health record specialist, especially when health information technology systems are needed in order to support the proposed changes. Finally, it's important to have a practice coach, someone who collaborates with the project team to overcome challenges and provide direction as needed to facilitate achieving your improvement goals. A practice coach is in it for the long haul, providing ongoing mentorship in the quality improvement arena to help your team identify improvement opportunities, define improvement goals, and to achieve them. Agreeing upon who is doing what from the start will not only provide clarity around roles and responsibilities, but establish a team with a broad foundation for success. In the last section of the project charter, we need to cover any major challenges that could occur during your project. Things to consider include IT issues, staffing constraints to assist with the project, or anticipated resistance to changes. When developing a plan with your sponsor, you'll work to minimize the impact of expected risks or barriers to your project. To recap, remember that a project charter is a document that defines your project. It is also an agreement between the various stakeholders that allows all parties to move forward with a common vision. Like aim statements, this document should be the product of a collaborative effort between stakeholders, and it should be reviewed throughout the life of your project in order to ensure that you haven't strayed from your expected outcomes and goals. If you have any questions about how to create or improve a project charter, or if you need assistance with starting an improvement project, please email the practice coaching team at pc@ccah-alliance.org. There are a few resources we recommend for a more in-depth look at project charters, which you can find in the link below. Thank you for watching this second video in our ABCs of Quality Improvement series and reviewing project charters with us. On behalf of the Practice Transformation Academy team and the Alliance, thank you so much for watching. Stay tuned for our next segment on creating a process map.